So the first thing I would do when I walk into my patient's room for a respiratory assessment is I would wash my hands, and then I would introduce myself to the patient. So I'd say, "Hi, my name is Michelle. I'm going to be your nurse today. How are you?"
Doing good. How are you?
Good. So then I would assess the client's facial expression to make sure it's appropriate, which it is. I would also assess his level of consciousness to make sure he's alert and oriented. Again, he is. I would look at his respirations to see if they look normal or if they're labored. Again, they look pretty normal, no respiratory distress. I would also see if he's in a tripod position. Put your two hands on your knees and lean forward a little. So this would be kind of like a tripod position. If he's like any labored breathing, he'd be leaning over, holding his legs. Okay, you can sit back. I'd also look at his skin color to make sure there's no cyanosis. Make sure that he's getting oxygen. Nothing looks blue or super red, so everything seems normal. Okay, so the next part of our assessment would be to palpate the posterior chest. We'd want to make sure that he's having symmetrical expansion, so I would take my thumbs, put them around T9 and T10, and ask him to take a deep breath. Just take a deep breath. Again. So the purpose of this would, if your hands would rise and then fall symmetrically, then that means that everything is normal. If one were to go up and one was to be lagging behind, then you would see some abnormalities. For some tactile firmitis, you would put your hand still on the back and ask the patient to say 99.
99.
And you would feel that tactile firmitis there. And then lastly, you would just palpate around the back to see if you feel any tenderness or anything. So you would just go along. And there's no tenderness or anything. Next step after palpation would be percussion. So you would percuss along the shoulders. And then do the other side. And then you would also want to percuss along the rib cages. And you would want to do this all the way down the lung regions. The next part of our assessment would be to auscultate. And you do this in a ladder formation going from one to the next, down, across, all the way down to the base of the lungs. So every time I move my stethoscope, just take a nice deep breath in and out. Great. So during auscultation, you would always want to notice any abnormal breath sounds. If there's any wheezing or high-pitched noises, any whooshing sounds, you would always want to hear clean inhale and exhale. So for the anterior inspection, you would just want to make sure that his respirations look normal, everything looks symmetrical, so not one side of his chest is moving up higher than the other while he's breathing, and he looks okay. So like the back palpation, you would do the same thing to the front. So you would take your thumbs and you would place them on the chest and you would have him take a deep breath in and out. And it rises and falls just how it should to show symmetry. And then you would also want to do the tactile firmitis on the front by asking him to say 99.
99.
And you'd feel that tactile firmitis. So again, you'd also want to palpate for any tenderness or lumps. So you would just start palpating from the clavicle and go down to the chest. You palpate along. Down the sternum. And there seems to be no tenderness or lumps. So again, with percussion, like we did on the posterior chest, you'd want to percuss with one finger tapping, and we would do this all along the base of the lungs, and on the ribs and the intercostal spaces. So you take your finger, and you would percuss down. And then you do the other side, just for comparison. And then lastly, we're going to auscultate the anterior chest, listening to the breath sounds on both sides to make sure that everything sounds clear. I'm going to go under your shirt. Breathe. And those sound clear and normal as well. But then you would ask the patient a survey of questions. So for some subjective data, you would ask the patient, how would you describe your health?
Pretty good.
Okay. And then you would move on to if the person has any cough or mucus production. So saying, have you had a cough recently?
No.
No. Okay. If the person were to say yes, you would ask when it started. Was it a gradual onset or was it just very sudden? You would ask the duration of the cough using PQRST. If there's any phlegm or sputum production. If so, how much and what the color of it is. And if the cough seems to come with any specific activity or position, as if he's lying down, going to sleep. And if there's any congestion. So the next question you would want to focus on is any shortness of breath. So you would ask the patient, have you experienced any shortness of breath lately?
No.
No? Okay, that's great. But if he did say that he had any, you would want to find more about this shortness of breath if it happens when he's walking upstairs, up a hill. Is it affected by any certain position, so when he lays down? And then you would also want to ask him if he has any chest pain. So do you have any chest pain when you breathe?
No.
No? Okay, and if he did, you would want to have him point to the exact location on his chest where he's feeling this pain. Ask when it started. Again, use PQRST to find out more information about the pain. So then you'd also want to take your past history of respiratory infections. So any past history of breathing trouble or lung diseases like bronchitis, emphysema, asthma, or pneumonia.
Never.
Never? Okay, great. So our patient seems to be very healthy. And then you would also want to question any unusually frequent severe colds or family history of any asthma, TB, allergies. Okay. And then moving on, you'd want to ask about his smoking history. So you would say, do you smoke any cigarettes or cigars?
No.
No? Okay. And to go into this further, you would say, have you ever smoked at all? If so, what age did you start? How many packs per day? For how long? Have you ever tried to quit smoking? If so, what helped? And have you ever lived with anyone who smoked? Okay, so then you'd also want to question the patient on his environmental exposure. So you'd ask him, do you work from home or do you go into an office area?
I work from an office.
Work from an office. Okay, so then you'd also want to ask the patient, how is your environment at work? Do you think there's any compromise to your breathing?
No.
No? Okay. So for this question, it would be helpful to know if they worked at like a factory or a chemical plant. if they did construction on the streets and there was always some type of dust or anything, that could have some impact on their breathing long term. And then you'd want to know about some self-care behaviors. So if he ever had a TB test or chest x-ray, pneumonia and influenza vaccines, so that could be taken in his history, finding out all of his vaccinations.